Hello, PsychU community, and welcome to today's webinar, Transforming Care Delivery, Implementing Integrated Behavioral Healthcare in the Real World. And thank you for joining us. My name is Roland Larkin. I'm a Senior Medical Science Liaison for Otsuka, and I'll be moderating our webinar today, which features three well-known experts in the field of behavioral health integration. Our speakers are Dr. Brandon Kitay. He is Director of Behavioral Health Integration at Emory Healthcare and also Assistant Professor of Psychiatry and Behavioral Sciences at the Emory University School of Medicine. We also have Henry Chung, MD, Senior Medical Director for Behavioral Health Integration Strategy at the Montefiore Care Management Organization, and he is Professor of Psychiatry at the Albert Einstein College of Medicine. And finally, Dr. John Kern, Clinical Professor in the Department of Psychiatry and Behavioral Sciences at the University of Washington Ames Center, which is renowned for its mental health integration. Today's presentation is sponsored by Otsuka, OPDC, and Lundbeck, committed supporters of mental health treatment. And our speakers today are reimbursed for their time. So at this point, we're going to bring the slides down and really get into a discussion. Dr. Kitay is also on the line, along with Drs. Kern and Chung. And just to go back to what I said a minute ago, when we met in October 2020, we were about 6 months into the COVID pandemic. And what we had discussed and what came through that day is that there was a crushing need for mental health services. And now we continue to witness unrelenting demand for psychiatric services, as well as what might be described as a nearly unprecedented appreciation among the general public for mental health issues. So Dr. Chung, I'd like to start this question with you. In your view, how has mental health treatment been transformed by the pandemic? And what changes are here to stay and which will kind of drift away as we move forward?
Well, Roland, it really is a great question, right? And I think the title of today's seminar, Transforming, is the key word. I don't really believe that we have fully transformed yet. So there's no past tense. We're still right in the thick of it right now. But I see several themes that are going on. First and foremost, I think the importance of integration models has been really demonstrated and valuable during this entire period. Just as an example, I'm sure some of the other panels will touch on this, the use of the collaborative care model in primary care integration as an example, it's now been demonstrated that using technology actually allows a level of seamlessness in terms of delivering the care model, right? I mean, the ability to have the psychiatrist, if you will, not in the room, but able to review records, electronically and use a care manager who's going to be at a distance anyway, again, using some form of technology to communicate. And then ultimately, if necessary, communicating with the physicians through an electronic health record, and then working with patients if they're that complex using telepsychiatry. All of that has come into play, whether you call that telepsychiatry phone-based technology or video-based technology, or both. So that's one big broad theme. I think the other theme relates to the awareness of disparity. Now, disparity is all over, right? So we can encapsulate this in the health equity discussion. It's not only racial disparities, but also disparities between patients who have severe mental illness and those who don't. And certainly the COVID crisis has now demonstrated with pretty good research that patients with severe mental illness have a greater mortality and morbidity risk as it relates to COVID. Now, we would expect that, given that we know that SMI patients have had shorter lifespans for years. Again, some pretty decent data. So I think the models around what we're calling reverse integration or general healthcare integration into behavioral health is another exciting and I think potentially transforming theme as it relates to population health. And then finally, I think workforce, is a huge issue, and that we've seen now how important mental health is, not only for our patients, but all of the healthcare workforce. And I would dare say that every large system of care who had mental health resources were pulled into the action to support their frontline nurses, physicians, physicians assistants who are providing direct service delivery during the entire COVID crisis. So those are the top themes that come to mind. I'm sure there are many, many more, but I think those are the ones that I think about quite a bit.
Yeah, thank you for that. How about Dr. Kern or Dr. Kitay?
Yeah, this is John Kern. I would echo what Henry has to say. I was prompted this morning actually to kind of review our literature on the provision of telemental health, and this is something that in the collaborative care literature goes back 10 years plus, and it's pretty robust. And we have been making the case for this, and it's actually been happening in certain places for years. But this is sort of its moment, you know what had and it's with telepsychiatry writ large. It seemed like a good idea, but on the regulatory side, it was going so slowly, and suddenly whammo, it's Katie bar the door, and everybody can do it, which is you know, one of the great silver linings. But I don't think there's any question that there's abundant reason to think that it's good medicine. And that you know, when we're talking about will it stick, and will the more permissive regulatory environment persist, you know, I think that there's very, very good reason to advocate for that, and I know that is actively being pursued. I just wanted to underline the fact that it's not just like, well, let's just do this because we have no other choice given COVID. It's an abundantly supported evidence-based practice.
Yeah, I want to echo that, and actually I would take it a step further and say that I think we are now disavowed of the notion that telehealth or telepsychiatry specifically is inferior to in-person evaluation. You know, I touching on also what Henry had said, you know, I moved institutions and have been asked to implement collaborative care through and during the pandemic. So I arrived at Emory as the Director of Behavioral Health Integration in July, and here we are in April. Through the pandemic, I've implemented all of the IT resources necessary, established the telepsychiatry resources necessary, hired the care managers, and we already have 2 primary care clinics up and running, seeing upwards of almost 100 patients within the first 3.5 weeks. So it certainly can all be done remotely and through telehealth. And the other thing I will say is these primary care clinics are all over the place in terms of geography. So, you know, my distance and my reach has extended much further, literally from my office at home, you know, than I could ever have imagined I could potentially practice. And our plan is really to expand these resources geographically and hopefully touch, you know, rural communities, for example, which is a huge issue geographically here in Georgia and a lot of areas in the United States. And so, you know, the only other theme that I will add through the pandemic, shifting gears a little bit, is I think there's been a huge, you know, acknowledgement on the primary care side of things of the importance of mental illness and mental health treatment, even for people that we probably would not have expected to be our patients that may have suffered at some point. You know, our patients are now under stressors, both medically, financially, and socially. Our colleagues are under a lot of stress and they need support. And these collaborative care efforts, these team-based efforts, really permeate and are really helping to support the quality of life, and in addition to the quality of care for our healthcare workers. You know, long haulers doesn't also refer to patients who've survived from COVID. It's the people who are caring for the patients who survived COVID. And so, you know, that is a theme that I keep seeing coming up, and looking at, you know, mental health resources for long haulers has been something that our institution has become very interested in doing, and looking at how collaborative integrative efforts can help facilitate that unmet need.